Next, we're fortunate to have Alanta Colley from leading Victorian community health body cohealth. Welcome. And also Karl Barrett from Victoria's Department of Energy, Environment and Climate Action, otherwise known affectionately as DEECA. Alanta and Karl will step us through a powerful example of what a joined up approach looks like when health and energy systems and actors come together to collaborate to meet some elements of this challenge. So thank you both, and over to you.
Thank you. For the last 2 years, the department's been working alongside cohealth to provide energy affordability support to residents of Melbourne's public housing high-rise estates. And this is part of a broader program by the department, the Energy Assistance program, to support people having difficulty with their energy bills.
Cool. So yeah, this has been an absolutely fantastic partnership. It's a bit of a no-brainer for us. Since COVID, cohealth has had the chance to actually employ lived experience bicultural workers to actually spend time on site at the high-rises in the public housing towers, and the opportunity to support residents. I think anyone who's worked in community understands that when someone comes to you, their needs are many, and vertical approaches where you're just focusing on health or just focusing on energy just don't work. So being able to actually collaborate has been really fantastic. So our approach has really been to employ bicultural workers and people with lived experience from the high rises. So our cohealth / DEECA staff are actually public housing residents. They know the residents in the towers where we work. They have strong linkages to the communities who are there. And so they're actually able to promote the services really well. And they actually understand where a lot of the public housing tower residents are actually coming from as well. So through collaboration, we've recruited bicultural lived experience workers, and they work alongside DEECA staff. And it's really enabled us to have a two-way referral process. So when people come with health needs to the DEECA team, they can refer to our team on site, and vice versa. So yeah, that's really been the way to do that.
So why support the high rises? We know that a large proportion of the residents that live in the high rises are from culturally and linguistically diverse backgrounds. What this looks like, it's someone like Collingwood, around 55% of the residents there are from a coal background, 57% if you look at North Melbourne, Flemington, and 61% of residents of Fitzroy are from a coal background. In addition to this, some of the high-rise blocks you see are specifically set aside for the over 55s. You'll see these in places like Albert Park, Prahran, Windsor, Brunswick, Northcote, Flemington, and North Melbourne. And also, given the high concentration of people, you'll find people who are experiencing challenges with their life. You know, it might be insecure or lack of work. It might be physical or mental health issues. And all this means that people face barriers to engaging with the energy market. And we've seen this in our work so far. So 1 in 4 of the residents that we've supported through the program have been missing out on important assistance through the annual electricity concession. And that's a concession that reduces the cost of every electricity bill by 17.5%. 2 in 5 have been unable to keep up with the cost of their energy bill, and so carrying a debt from bill to bill. And then 70% are not on their current energy company's cheapest plan. They're paying a lot higher rates than they ought to be. And what we've also noticed is that many people aren't even receiving their bills. So with the explosion of e-billing, a lot of people don't even click through to open their bills, so they don't even know if they're getting their concessions or they have a debt or they're paying higher rates than they ought to be.
Interesting. Beautiful. Again, as I think Virginia touched on, the hardship people experience between energy and health, they're not separate issues. We anecdotally, our staff are constantly sort of informing us about, you know, when they are experiencing hardship, energy would be one of the first things that they try to reduce. So particularly during the COVID pandemic, we saw people isolating in 40-degree plus temperatures in poorly insulated public housing, with no air conditioning. Most of the older public housing stock have no air conditioners in there. So as we shift into hotter and hotter summers, that's a much bigger health issue. So we see people cutting back on their energy usage, and we know that that impacts their health. So particularly public housing residents, we see lots of deferred healthcare needs. We have recently been working with our oral health team to bring trucks on site to the high rises, and we're seeing public housing residents who haven't seen a dentist in the last 10 years or have never actually been to a dentist. And by the time they present, some of those health issues are so high, so complex, that the healthcare needs are much higher. So, and we know that it's the stress from energy bills that flows through to pushing some of those preventative health measures down the list. So people are not able to sort of do that preventative healthcare that will invariably end up in people presenting to emergency or with much more complex health needs. Yeah, I think I've covered that.
So what we've done to date in the 2 years we've been running the program, we've completed over 2,900 applications for the power saving bonus. That's bringing in $250 payments right to residents where they need it. We've supported 2,100 residents with in-depth support. So what that looks like is getting on the phone, calling their energy company, helping to switch people onto cheaper plans with their existing retailers. And in that time, we've saved residents $157,000. We've also completed $327,000 worth of utility relief grants to help clear debts that residents are carrying on their energy bills. And then we've also managed to apply misconcessions, $56,000 worth of misconcessions. So with the residents, a lot of them are really confused about how energy works, and they lack the confidence to phone their energy company on their own, even when the savings are significant or the issues are large. So I'd like to share with you a couple of recent examples that we've seen at the estate. So back in February, we were at the Flemington estate, and we came across a lady who'd been living without power for 5 months. She was experiencing mental health and physical issues. She was extremely socially isolated, and she lacked a phone. She'd been making do by going to a local charity regularly to get fresh food and then cooking it on the shared electric barbecues on the estate. Obviously, this was a really terrible situation. So luckily, she walked in to see us. Stephen, who you saw the photo of in one of the previous slides, he did a great job. He phoned her retailer, got her connected straight away. We then set up an affordable payment plan to mitigate the risk of her going down the disconnection pathway again. We then applied for utility relief grant to clear her debt. And then we also switched on to the cheapest energy plan that was available with her energy company. It just meant that her payments were fully maximized. The second story I'd like to tell you about is a Collingwood resident who'd gone overseas to find their missing son. And while they're away, their Centrelink payments stopped. She returned to Victoria, and she was experiencing depression because she was unable to find her son overseas. And compounding this, she was now facing disconnection for a $1,200 arrears on her electricity bill. So luckily, at the time we saw her, the power saving bonus was still open. So the first thing we did was apply for the $250 payment. Then we applied for utility relief grant, and that was enough to clear the $1,200 debt. We noticed that she wasn't receiving her concessions on her bill, so we added her concession card so that her bills were cheaper. We switched her onto the cheapest energy plan that was available through her energy company. That saved her $350. So you can probably see from those two examples there that we're solving part of the problem. And I'd like to think, we don't have data to back this up, I'd like to think by taking care of the energy issue, they then are able to get on and concentrate on arguably what's more important in their lives.
So for the future, it's a series of question marks for us at this point. The future of the program will be very much pending on the budget coming through in May. But I think the other thing that we will have to navigate and understand more about is the announcement that the towers are all being demolished. So there's still not a great deal of information for residents about where they're going, where they'll be living, and it's quite a complicated process. We know some towers are going before others. So for all the residents who've gone through the support from the DEECA team, we'll be relocated, and they'll be signed up with new utilities companies and potentially need to go through some of these processes again. So I think for us, it's a series of question marks, really hoping that there's some thought and planning put into place about energy affordability for residents as they get moved into the new public housing settlements as they're built. So yes, we're super curious and going to keep having the discussion to see how we can best support residents through that journey.
Thank you.
Thank you. Thank you so much to both of you, Karl and Alanta, for what's obviously an incredibly important initiative. And, you know, what comes to mind for me as well is just the stories you've told around things that are already available to those residents, but, you know, the knowledge and the capacity to access those concessions or you know, relief is just, you know, needs that extra help. And certainly, you know, that's what our sector is kind of about. And it's great to see that, you know, DEECA is really partnering so closely to bring that relief to people who need it and deserve it and are eligible for it already. So very much backing in some of the work that we've done previously on like health concessions, and so many people missing out on them just because they don't know that they're around and they're available. So thank you so much for shining a light on how we can work together to alleviate that. I love just a bit of a provocation too, that, you know, this is a part of the solution, and perhaps there are some, you know, systemic solutions that sit above, you know, those individual fixes as well.